This 51-year-old retrenched man who broke his right ankle hangs outside Zimbabwe's biggest hospital after being discharged. He has no painkillers or other drugs prescribed by the doctors to recover, and his medical insurance is not being accepted by many health institutions and pharmacies.
They said they are taking too long to pay for the services. At times we pay cash if they don't take these medications. You know, nowadays cash is very scarce to get it. That's a big challenge.
It is people like Mbambo that Zimbabwe's Association of Healthcare Funders say have stopped seeking medical treatment as cost of health services has gone beyond them, even with medical insurance. They have found the solution in medical drugs or herbs sold in streets. Their sellers do not want to be identified for obvious reasons, fear of being arrested.
These herbs really work. So, for example, if someone comes for a BP herb, after 7 days he will return here and say it has worked. The problem is gone. So it is money problems and the strength of herbs which makes people use them.
But the Zimbabwe Association for Doctors for Human Rights says the answer in the country's high cost of drugs or health services is not in herbs.
Some of the herbs that have been used by people, those are things that have not been tested in the labs. We do not know their effects on the liver. We do not know their effects on the kidneys. So you might end up actually having a kidney failure from using herbs which have not been scientifically proven and which have not been proven to be safe and effective.
The rights group wants President Emmerson Mnangagwa's government to increase its spending on health so ordinary citizens can access it. The government says it is working on the issue and it has started sourcing medical drugs. On Wednesday, the Indian government donated medicines worth $250,000.
The more medicine that we get, the less will be the cost to the client. So we are working on a plan to make sure that we fill up our warehouses, we fill up our pharmacies, to the brim. And we shall then be able to also supply, through that same mechanism, the private pharmacies. They will have to reduce their prices. And then we will end up with more patients arriving at the institutions.
That would be good news for people like Nkulile Mbambo, who cannot get the medication needed to make a full and fast recovery. Columbus Mavhunga for VOA News, Harare.